Canada, Hong Kong detect Omicron variant in travelers from Nigeria. 3 Nigerian travelers have been detected with the Omicron variant of COVID-19 in Canada and Hong Kong. The government of the Canadian city of Ontario confirmed that the 2 cases are in the capital, Ottawa. Both patients are in isolation, while public health authorities trace their possible contacts, federal and Ontario provincial officials said. I was informed today by the Public Health Agency of Canada that testing and monitoring of COVID-19 cases has confirmed 2 cases of the Omicron variant of concern in Ontario, Health Minister John Duclos said in a statement on Sunday, November 28. As the monitoring and testing continues, it is expected that other cases of this variant will be found in Canada, he added. The statement did not specifically say whether the 2 travelers detected with the variant were Nigerian nationals, but said the variant was highly transmissible and required urgent action. Meanwhile, a 37-year-old male who traveled from Nigeria has been identified as the 3rd case of the Omicron variant of COVID-19 in Hong Kong, health officials reported at a news briefing Monday, November 29. According to government data, the man had transited from Ethiopia and arrived in Hong Kong on November 24. He had been quarantining at the Ramada Hong Kong Grand View Hotel before testing positive for the variant. The man was asymptomatic and had received 2 doses of a Moderna vaccine. Sophia Chan, Hong Kong Secretary for Food and Health, said in the briefing, Our existing system is robust and also able to stop any transmission, Chan added, stating that the use of burden requirements, quarantine and testing enabled them to prevent the new COVID variant entering the community. The Omicron variant was recently discovered in South Africa, and it has led to panic worldwide as many countries, including the EU, United Kingdom, and the United States, have banned flights to and from South Africa and other Southern African countries in a bid to contain the variant, despite warning by the World Health Organization against countries hastily imposing travel curbs. To reduce the transmission of the Omicron variant, and out of an abundance of caution, Ottawa Public Health Canada advised individuals who have been in Nigeria, South Africa, Mozambique, Botswana, Zimbabwe, Lesotho, Eswatini, and Namibia within 14 days before arriving in Ottawa, and members of their households to immediately self-isolate even if fully vaccinated. The World Health Organization has listed Omicron as a variant of concern, stressing that it could take several weeks to know if there are significant changes in transmissibility, severity, or implications for COVID-19 vaccines, tests, and treatment. On Friday, November 26, Canada banned travel from 7 African countries over concerns about the spread of the Omicron strain. Nigeria was not one of them. The World Health Organization Monday said its scientists and other scientists around the world are working urgently to find answers to the questions that have arisen from the discovery of Omicron. Director General of the organization, Dr. Tedros Adhanom Ghebreyesus, made this known at a special session of World Health Assembly where he said, "We don't yet know whether Omicron is associated with more transmission, more severe disease, more risk of reinfection, or more risk of evading vaccines. Scientists at WHO and around the world are working urgently to answer these questions." He urged all countries to be wide awake to the threat of a virus and said that South Africa and Botswana should be thanked for detecting, sequencing, and reporting this variant, not penalized. If you enjoyed this, please like, share, and subscribe so you can get notifications.